All right, we are recording. Hello, welcome to our presentation. We are IPTS group 4B with Emily F, Irina, Owen, Meredith, Pranav, Emily S, and Misha. And we'll get started. All right.
So just a little bit of background on the case about how this case came about. So 500,000 healthcare workers left the healthcare field from February 2020 to November 2021. And I think we all know this is the time that COVID sort of came. There's a projected 16% increase in the need for healthcare workers through 2030, which unfortunately coincides with all these workers leaving. The impact of this has on the healthcare teams have been staff shortages, limited social bonding, as well as on the individual, exhaustion, compassion, fatigue, because I think y'all can recognize that having a lot of workers leaving the field leaves more work for everyone that's left. There's a focus on building culture of well-being and resilience to battle workplace stress through this project. So the Hope Commission is the transformational change effort of M Health Fairview to bring more equitable outcomes and inclusive environments and experiences for patients, employees, and the community. This project will be looking at recommendations for reform from an interprofessional team. Next slide, please. So this is a bit of background on the different team members in the case. So first we have Kadra. She's a Black Somalian female, family med physician, originally from Kenya. She's Muslim, married with 2 kids. Personal impact from COVID has been 2 uncles that have passed away from COVID. She was inspired to become a physician from childhood by a doctor in a refugee camp. Her motivations for becoming a doctor include helping with disparities in health, but she's discouraged by decisions that she's had to make during COVID that have questioned her own moral code with strained resources and personal time. She's been more distracted and fearful of sharing her beliefs with the team lately. We have Sarah. She's a white female nurse from the Midwest. She's Christian, divorced with 2 kids. She's been discouraged by seeing patients and people struggling or outside of work not taking COVID seriously, and she's struggling with managing childcare as a single mother right now. You have Jessie. She's a white Latina female nursing home aide with a wife. She's Christian. She feels a strong connection with patients, especially those that are Spanish speaking. She's often subject to homophobic and racist remarks from coworkers and patients. She dreams of a work environment that will address discrimination and microaggression. You have Jonas. He's a Black Latino male in environmental services in the hospital from the Dominican Republic. He's Christian, single. He's taking care of older parents at home, has the worry that he'll bring COVID home from the hospital to his parents. He feels unappreciated and underpaid. He'd like to move up and take on greater roles within the hospital. And he's considering moving to a hospital closer to his own home that pays more. Finally, we have Andrea. She's a white female healthcare administrator from the Northeast. She's been feeling tired from putting out fires instead of addressing systemic long-term problems, which is why she got into her field of work in the first place.
All right, I'm Emily Swanson, and I can take it from here with radical belonging. So radical belonging in a healthcare team is when each team member is valued and understood not only for their professional skills, but also for the lived experiences that they bring to the table. Everyone on the team shares equal responsibility for protecting not only their patients, but also their fellow team members. So on a team in which the concept of radical belonging of the team members is valued, members will be equal in standing regardless of their role, valued for the diverse experiences that they bring to the table. They will act in the best interest of each other, as well as their shared patients. They will have a communal sense of responsibility for looking out for each other, especially the most marginalized among them. They will advocate for one another, and they will loudly and enthusiastically support one another without fear of repercussion. Fostering a sense of radical belonging within teams is important, as it does lead to a stronger sense of community within the team, also a sense of personal and professional safety, and ideally all team members will understand the unique value that they contribute to the shared goals of the team. So when radical belonging is centered in healthcare teams, structures are naturally implemented, which will afford team members, especially the most marginalized among them, additional safety within the team. So this can include providing and promoting support resources, ensuring that all team members are aware of problem and grievance resolution processes, emphasizing the ways that the team can continually improve, not only their understanding of other team members on a personal level, but especially those with different lived experiences than their own. Ideally, team members who feel like they belong on a team will emphasize learning from one another and will ideally develop into better healthcare professionals as a result of their participation within the team. During the worst of the COVID-19 pandemic, we saw that change could be affected when members of interdisciplinary teams banded together around one another. So due to the virus, the safety of all healthcare workers was at risk every day that they reported to work. And I think out of this danger came a sense of collective purpose. And so across the US, you saw interdisciplinary teams in hospitals and other medical organizations. They would collaborate to address some of the biggest problems that they faced during those early days of the pandemic. These activities included demonstrating for hazard pay, unionization activity, donating vacation times to coworkers with sick relatives or their own illnesses, advocating for stronger mental health resources at their workplace, and sharing PPE across departments.
So next is organizational, team, and individual recommendations to support radical belonging in healthcare. At the organizational level, you can define your company's meanings for diversity, equity, and inclusion and how to put that into your company. Establish what types of behaviors will and will not be tolerated and how to safely report incidents that happen. Check in with the team regularly. Create clearly stated mission, vision, and value statements. Regularly ask your employees for feedback and their ideas for change. Promote team successes. Get team members involved in any way that you can. Empower team members through educational opportunities that they might not otherwise have. Be transparent about communicating goals. Be creative and take time to pause and reflect on your culture as well as others' culture and practices. For team recommendations to support radical belonging, at the team level, you want to implement an HR initiative, address implicit biases team members may have, embrace diversity, and encourage change if needed. And according to HealthStream, 93% of employees believe that a sense of belonging drives organizational performance. 70% say that their organizations failed to promote inclusion, and that there's a 50% reduction in turnover risk when workplace belonging occurs. Finally, at the individual level, recommendations to support radical belonging include talking and connecting with others, speaking out about what you believe, forming support groups, and forming your own mission, vision, and value statements that align with your company.
So at the start of the pandemic, there was kind of this idea that COVID was this great equalizer that was affecting everyone equally. And that has really turned out not to be the case. And I think that this is especially important to acknowledge in light of so many of the healthcare professional teams being from different backgrounds, some of them from different countries. In particular, Black and Hispanic people have had higher rates of COVID-19 cases than white people throughout the entire pandemic. Recently in April of earlier this year, those rates have started to equalize, but as you can see from this graph, those disparities have been really, really significant. And given the significant differences in cases, there have also been similar trends in mortality rates. So this pandemic has differentially affected different races in the United States. And now that we've had a bunch of new treatments come out for COVID, we're also starting to see disparities in who's getting those treatments as well. So monoclonal antibodies are one of the first treatments that came out. And as you can see from those numbers, Black, Asian, or other races were 22.4%, 48.3%, and 56.5% less likely to receive monoclonal antibodies, and Hispanic patients were 57.7% less likely to receive this treatment. When it comes to things like Paxlovid, one of the most recent COVID treatments that's been approved, Black patients were 35.8% less likely, American Indian and Alaskan Native patients 23.1%, and Hispanic patients almost 30% were less likely to be prescribed Paxlovid. In addition, there's this interesting note that for dexamethasone and remdesivir, which were two kind of earlier treatments in the pandemic, the rates of receiving those are actually relatively equal. So it seems like some of the newer treatments, monoclonal antibodies and Paxlovid, which have proven to be really effective, have these significant disparities in race, while the older treatments, dexamethasone and remdesivir, are still being given out equitably. And the last thing I wanted to touch on, given that some of the members of our team are from different parts of the country, there are still huge disparities in who's getting COVID vaccinations, which has proven to be the most effective way to stop people from dying from COVID. So as you can see from these statistics, only 58 of the WHO's 194 member states have vaccinated 70% of those populations. And the really striking number is that in low-income countries, only 37% of healthcare workers have received a primary vaccination, and only 15% of all people in low-income countries have received that primary vaccination. These disparities are pretty appalling, and there's been a lot in the news about Pfizer, Moderna, and patent law. But it's pretty disappointing to see the rates of vaccination so low in countries around the world. In the US, there's been significant disparities in getting booster doses. Only 59% of Black people have received one COVID booster dose COVID vaccine dose compared to 64% of white people. And then even more striking, the numbers for booster doses there at the bottom are significantly lower for people of color, with the exception of Asians, than they were for white people.
Hello. So in the COVID stressed out healthcare system today, it's excessive to ask employees to carry out their roles and be completely responsible for any healthcare disparity effects that stem from these roles, like lack of radical belonging. The start of radical belonging begins with institutional changes. There are short-term and long-term goals institutions can take to ensure their employees feel secure and comfortable to carry out their roles. To begin, some short-term goals that an institution can implement would be to define and communicate what inclusion, diversity, and equity means in the workplace, to establish what behaviors are unacceptable and provide a way for employees to report it in a safe way, to solicit and analyze information from employees about areas to improve that will allow them to feel more included. And finally, I believe that a board should be created to specifically address these disparities. It should be composed of representatives from all professions, so everybody feels included. And that this board should discuss and promote guidelines to improve workplace inclusion and diversity. Next slide. Some long-term goals would be to mandate training covering implicit bias, diversity, equity, and inclusion all across all professions. And for those that need additional training should be provided. Should also create a structure that allows for healthcare workers to be provided with a mandatory break throughout their shift. With the COVID effects, there's a lot of staff shortages, so a lot of staff have to work overtime or they don't get their breaks. So a mandatory break would definitely help these healthcare workers feel less stressed out and more comfortable in their roles. Also, to provide mental health resources that do not increase the expense of employee. And lastly, should increase benefits like a daycare program or increased pay.
So successful implementation of radical belonging within members of a healthcare team. This can be measured based on each person's level of contribution offered to the team by each subsequent member, no matter their area of expertise, their comfortability to speak out and express their own opinions and experiences, their willingness to learn and grow as a healthcare worker and as a person, their ability to work within the team in order to improve worker morale, and especially during mentally challenging times such as COVID, and the level of encouragement towards embracing diversity and encouraging change when necessary.
And these sustainability slides are presented separately by Emily F., who could not join us today. So we'll briefly go through this one. And I believe she has one more. And then her second slide. Okay, and then finally.
What we learned about effective teamwork is, in order to be an effective team in the healthcare setting, it is essential communication. In order to improve patient outcomes, open communication amongst team members is essential. Openness within the group, where any member can share their experiences and ideas without being judged or disregarded, is best in order to provide a positive work environment. And if employees have good work experiences and benefits with those experiences, they're more likely to stay at their institutions.
And here are our sources. And that concludes our presentation. Thank you very much.